Hey guys, it's Dr. Brian Anderson, Life Essentials Chiropractic in Missouri City. Today we're talking about osteo or degenerative arthritis. So there's a lot of misunderstandings here. Sometimes people think arthritis is just normal and it's just what happens automatically when you get old. And I'm here to tell you, arthritis is almost never normal at any age. So when you have arthritis, degenerative joint disease, 𝗵𝗲𝗿𝗆 spondylosis, arthrosis, there's a million words for it. And when it comes to degenerative arthritis, all that means is usually they're just naming different pieces of the joints or anatomy that has mechanical abnormal wear and tear that's been there for a really long time, and it creates abnormal joint and tissue loading. And it's sort of similar to like, the way I think about it is like if you walk on your feet, right, the way they're designed to be walked on, they don't wear out. You can walk on those feet for to the day you die. But if I walked on one of my ankles sideways, it's not designed to hold the weight of my body in that alignment. So you have abnormal mechanical stresses, biomechanics, alignment issues, and that creates abnormal wear and tear just exactly the same way as a wheel on your tire when your front end's out of alignment, and it creates abnormal wear and tear. You can keep changing out that bad tire over and over and over again, but if you don't fix the alignment, it's going to continue wearing out the tire the same way over and over again. So today I just want to show you a quick example of what that looks like in a spine. So this applies to almost any joint in the body, but one of the most common areas that we see nowadays with people that have computer jobs, continued issues with alignment in their neck, tech neck, computer posture, cell phones, things like this, even old injuries, whiplash. There's a lot of things that can happen. It's usually either an all-at-once misalignment, like an injury, where you maybe got rear-ended and the normal anatomy should be a C-shaped arch in your neck. Someone comes and slams into you from the rear end of the stoplight, and you create this kind of jerking motion, and that can dislodge the normal alignment pretty significantly in the neck. Or so that all-at-once things, or just little by little things, like sitting at a computer little by little by little by little by little by little over 5, 10, 12 years at a desk, and you can just very slowly over time start to shift that posture, shift that alignment. You actually start to shape that way on the inside. Regardless if it's an old injury that was never treated properly, or if it was just a gradual misalignment due to the wear and tear of just your day-to-day routine throughout life, you can't get degenerative changes without constant, continual bad mechanics. So how this happens is the weight of the human skull, for example, in the neck is like a bowling ball. It's like 12 pounds being carried around all day long. It needs this spring and this shock absorption. You have these long, giant bony projections that are designed to interlock and hold that weight with no wear and tear for 100 years, right? But when you shift that force to the front of the smaller portion of the bone in the disc that's not designed to hold that weight, and then you lose that spring for shock absorption, now you have abnormal forces. So this is an example of this, right? So if you look at this, this is a pretty good cervical arch. This is a patient of ours who came in and was having some challenges. We do pretty high level advanced spinal correction techniques where over time we started to move and train and move and train and move and train over time. When we started, this arch should be 45 degrees. He started at an 11. And after 8 to 10 weeks of repetition and continued treatment and alignment and strengthening, he was able to get corrected to 36 degrees. Pretty great changes for him, and was able to resolve all of his issues. This is a patient who's been slowly shifting into that bad posture, unresolved, untreated, and really unnoticed for a long time, because a lot of times this doesn't cause pain in the beginning. Over time, it actually can create so much stress on the joints that actually warps the shaping of the bone. So normal bone should be these nice, clear, clean edges, just like a picture frame. You should have normal, equal spaces of the disc in between the joint. And it kind of starts off that way for her. Starts off clean here where there's areas of no stress. There's pretty perfect bones here, areas of zero stress. And then right where you get this kink, where all that force has been concentrated, unaddressed, untreated, unresolved for so long, you get these big kind of spiky, sharp, jagged, irregular edges of the joint. And even the soft tissue of the disc will start to shrink over time. So this is called degenerative arthritis, or people call it degenerative joint disease. It's not a disease, and it's not aging. This particular patient happens to be 72 years old, but all of her bones are that exact same age. It's not like some of these bones are 32 years old, and some of them are 17 years old, and some of them are 50 years old. Every single bone's 72 years old, and most of them are perfect with no wear and tear, just like when she was 16 years old. The only area that you see degenerative arthritis, osteoarthritis, degenerative joint disease, stenosis, all these types of terminologies, usually it's just due to continued wear and tear or an old unresolved injury, and it was there so long it started to warp the shape of the bone and joint, started to change. And that can create some issues because now those joints are stiff and achy, they don't move, they don't hinge very well, they kind of have excess bone growing around the area, and the longer that goes on, the harder and harder it is to get mobility in the joint, to get range of motion. You start not be able to turn your head back into the driveway in traffic. You start getting these, especially in the morning when you haven't been using it for a while, it's kind of stiff and achy, feeling like the Tin Man from Wizard of Oz trying to get things moving again, right? So corrective chiropractic not only treats the actual range of motion issues and helps resolve the normal biomechanical changes in motion, helps relax the tissues that get spastic and tight around it, helps soften some of the disc again and make it more soft and more functional over time with certain rehab exercises. But it's actually correcting the real root cause of the problem, which is the structural alignment. Over time, we literally can identify this, take pictures, and for you as an individual, create a customized plan of attack. We're not just gonna bring you off the sidewalk and pop your neck. We're gonna take imaging when necessary. We're gonna be able to get that picture that's worth 1,000 words to be able to see exactly where your issue is. Over time, we can move and train very specifically through specific corrective adjustments and a customized therapeutic exercise program that's gonna teach all the tissues around that to kind of learn that new home over time so you can create a lasting change. So there'll be a few more videos on this page where we talk about a lot more information about arthritis, but I just want to take a minute and give you that picture so you can actually see what it really looks like on the inside.